Sexuality has always been a problem. It's just that our mothers got married at the ages of 18 and all that, whereas with us, at the age of 18, you should still be in school.
When I have to go to a clinic, you always find people who are still judgmental, and like they don't really treat you as a person to actually like you are actually deserving of the information that you get there. So yes, we do have access to the services, but however, the treatment that we get from the services is not really good.
Well, my message today is nurses should be facilitators of services, not barriers.
There are laws and there's policies, there's amazing policies and laws, but how they're being implemented and directed to young people isn't correct.
And my own religious belief should not prevent a young person from getting life-saving information. Health providers are the same, because health providers sometimes, using their own judgment, prevent young people from accessing good quality services.
We need to equip them, give them the correct knowledge so that they make responsible decisions. And then one other thing that we're finding, given the low retention rates, there's also a low success rate in reaching those young people who are out of school. So if we're saying a lot of the young people are dropping out of school, we are not able to reach them with the formal education system. We are also not able to reach them well when they're out of school.
Sometimes a good program is started by the government and the partners. Those programs do not remain in place. They disappear after a while. The most important issue that makes this campaign unique is the fact that it tries to bring together the Ministries of Health and the Ministries of Education to come up with a clear commitment to young people's sexual and reproductive health, information and services.
The campaign is unique because it brings together sexuality, education and reproductive health needs of young people in one campaign, and often we find that campaigns tend to speak about sexuality education, and other campaigns they seem to speak about the sexual and reproductive health of young people. But having these two issues together is really key for the campaign.
So both of them are very critical to the prevention of HIV, to the prevention of teenage pregnancy, to prevention of sexual violence, and offering young people services and preparing them for the future in general. Sexuality education is about giving the right messages at the right age, yes, and being explicit about the facts. This initiative has been an example of where we have different organizations, bilateral foundations, UN agencies, civil society coming together and joining, putting resources for the ESSA commitment to be realized. The age to consent to sex is different for different young people and for different countries. And some countries allow the young girls to consent to sex at 16, others are much earlier ages, and others at 18. And so we know that many of them are sexually active earlier, and we need to harmonize the ages and prepare young people for having access to services. And we know that the level of condom use among our young people is generally increasing in the region, which is very good and positive when you look at it overall. But the rate is low, too low and too inconsistent. 34% for females, 45% for males. The condom supply in the region, overall, it's improving, yeah? And also the stock out is reducing. But still, the number of condoms per man, yeah, per year is too low.
My message is that this is the time for us to be accountable for towards the needs of young people. We cannot continue to give any excuse. We now have evidence that cuts across 21 countries in the region. We know what young people need. We've heard their voices. They're speaking to us. We're speaking to them. And I believe that together we can respond to these needs and sustain our interaction with young people and provide the services that they need.
We suffer from limited HIV knowledge and also conflicting messages and also discriminatory messages, policies that define who can and who cannot access the services. Now, what makes this more complex is that when a young person wants to use protection, we are often asked to bring a consent of a parent or a guardian. Now, what is a young person to do in that ideal situation? They will obviously have unprotected sex. We, or rather the government, promised every citizen, including us young people, a better health, well-being, and prosperity. We do see the progress, but however, what we need to see is the progress that will impact the lives of young people directly.
And we know that sexuality education does not promote promiscuity. We know that it does not increase the number of sexual partners. We know that young people do not start sex early. And we know that when they decide to have sex, they protect themselves. Those have very, very good outcomes for Ministry of Education and Ministry of Health. Those are good, outcomes for young people having healthy outcomes and girls not dropping out of school or not becoming HIV positive.
When we consider that most of our young people complete less than 6.5 years of education, we can see that our youth are not getting the opportunity to develop their cognitive and other skills, and therefore they are not able to successfully transition into adulthood.
Voluntary medical male circumcision, for example, all of these are actually improving and increasing in our region, but we still need to scale up and to improve access to these services.
On a positive note, thanks to better and more affordable treatment, our young people living with HIV in the region are living longer, although they still face the issues, challenging issues such as stigma and discrimination.
About 40% of all clients who come to services are young people. That tells us that if the services are available, if the services are quality and the services are friendly to young people, the young people will use them. High-level commitment to address gender policy and programming is happening in our region. And one example is the fact that SADC has a gender and development protocol. School-related gender-based violence is receiving increasing attention in our region, and it impacts on adolescent girls as well as adolescent men, young men. But I think it's an area that we are scratching the surface. We have not done much about it. Many girls and many boys are still being abused in the school system. This is what we want, less pregnancies in the school system. We want to monitor each minister to say, I don't want to see any pregnancy in my school system. Because I have been fighting to get the girls into the school system, and they started primary school. Why are they dropping out because of a pregnancy? So, number one, I need to retain them in school, but of course, I also need to prevent pregnancy because that's one way they drop out. And if they become pregnant, we need them to be returned back to school after delivery. And the ministry have to, facilitate that and have good policies, because some people believe that, okay, if a girl has become pregnant, she's a bad influence. She shouldn't be in the school, or she should be taken to a place far away. Another school. No, let her come back, and she actually can be a role model for the other girls. She says, what mistake did I make that the others should not be making? And the girls should be actually empowered to say, I made a mistake, I didn't use contraception, or I was coerced into sex, maybe I was violated by somebody, that's why I became pregnant. But you can avoid it by doing X, Y, and Z. And that's part of the empowerment of young people.
What we're really keen on doing at this point is to support the implementation of the findings of the report at country level, and to make sure that our partners that are working on the ground are relating to the report and using the materials that have been produced through this report to refine the programs they're doing on the ground. And we hope also that we will institute a process of monitoring how the program is being implemented once the ministers adopt the program and the country begins to move forward. And we are interested in mobilizing the civil society constituency to advocate for resources, for the capacity to be developed to implement the comprehensive sexuality education as well as sexual and reproductive health services for young people.
We need to work together on a common agenda for adolescents and young people to deliver comprehensive sexuality education and services, and not to say education is doing this in school, health has an adolescent program that they're working on. How can we make sure that whatever it is that we're doing is aligned? If young people are receiving sexuality education, health should be ready to meet them with the services that they require. We need to align our policies so that health is saying the same language as education, not that education is saying one thing and health is saying another thing, and yet it's the same young person that we are all talking about.
All our governments signed the ICBD agenda, which says that a program of action which says that young people have the right to services, and young people have a right to confidentiality and privacy in their access to services.
We really need to maximize the protective effect of education by keeping adolescents and young people in school.
The connection between the different ministers and coordination between the different ministers, maybe having an interministerial coordination for adolescent health and well-being and development in general, that will be very critical. Some countries do have it, but nobody holds anybody accountable whether the committee is working and consistent. We need to ensure that health services are youth-friendly and non-judgmental, confidential in nature, and reach adolescents and young people when they need them.
And then invest in new and social media to reach adolescents and young people with comprehensive sexuality education and link them to services.
We want schools to provide their learners with comprehensive sexuality education and also refer them to health services within the community. We want training and capacity of building for teachers who will assist young people in dealing with the sexuality challenges, sexual needs, and all the issues that they face.
So we need to explore new and innovative financing mechanisms for national and international resources to be allocated to young people.
So I think the signing of the commitment is the start of the process of implementation and really monitoring progress at country level.
And friendly, sensitive, non-judgmental counseling that will also respect our needs as young people.
Integrate and scale up youth-friendly HIV and SRH services to improve access and uptake.
They have to have a proper handover and proper preparation of the person who's taking over so that good quality programs continue.
The time to set everything in motion and everything that will impact the young people's lives is now.
But if we do something now and we actually address the needs of young people today with them and collectively, we can make a major difference in the development of our region.
As a young person, what is our reality? I mean, we are all in a stage where we explore our sexuality, and therefore we do require sexual and reproductive health education and services. Because you all know, a significant number of us are already in relationships. Some have started a family, while others may already be living with the HIV virus. Now, despite the fact that we as young people have rights and needs of sexual and reproductive health, the society tends to ignore those rights and perceive us as too young to have these rights. Now, I can tell you one thing. Ignoring those rights won't stop us from having sex, nor will it decrease the early pregnancies and the HIV rate in South Africa.
My message today is, talk to us, not at us. Hear us talk about sex.
I urge you guys to see us young people as partners instead of just mere beneficiaries.
Young people are sexually active, they need information, they need education, they need services, and this is the time to respond to all of these issues.
I believe that if our leaders actually give young people a chance to actually lead these projects, we may actually see a lot of change happening in our community.
My message today is we want condoms to be available so that we can easily access them.
And I think that it is important that the campaign is led by young people, policymakers provide the resources, the education and the health sector play their role, and I think together we will be able to reduce some of the problems that young people are facing on the continent.
To my leaders, I'd like to say, take us seriously and not just see us as young, inexperienced, unknowledgeable people, because we know a lot and we can add value and we can help solve a lot of the problems that we're experiencing in all of our different countries.
Do not be forced into something that you don't want, and do not do it because others are doing it.
So to young people, this is your report. It's a very important document. You can act on this report. You can use the report to advocate for services to be delivered to you. You can hold your governments and your political leaders accountable.
The time to act is now, and the time to advocate for everybody for support to young people's programs and resources for young people's programs is very, very important.
Young people today, time to act now.
From all my UN agencies, I say thank you for the support thus far. We need to increase that support much, much more. Thank you.